Okay, let's talk about one of our toughest clinical challenges. You have a patient newly diagnosed with lung cancer. They absolutely need to quit smoking to improve their odds, but they're also battling major depression. So what do? Well, today we're going to dive into a brand new study that tests a really novel approach for this exact patient group.
Right? It's a situation we see all the time. And frankly, our usual playbook doesn't always cut it. So in this explainer, we're going to unpack a randomized controlled trial that looks at a new potential use for esketamine in this very high-risk population.
All right, so first, let's just set the stage here. Why is this specific group of patients so incredibly important to focus on? I mean, just look at that number. A 30 to 40% reduction in the risk of dying? That's huge. In fact, that can be even better than the benefits we see from some of our best cancer treatments. This really reframes the whole conversation, doesn't it? Smoking cessation isn't just, something on the side. It's a frontline, life-extending treatment in its own right. And this trial, it really zeroes in on that super tough-to-treat group. We're not just talking about any smoker. These are heavy smokers. They've just gotten a cancer diagnosis, and they're dealing with depression that hasn't responded to other therapies. I mean, that's the perfect storm, right? It's exactly where our standard approaches tend to fall flat. So how did they actually go about testing this idea? Let's get into the nuts and bolts of the study design.
Okay, so what we have here is a really solid study design. It's a multi-center, randomized, placebo-controlled trial, the gold standard. They ran it across 8 different centers in China, which is great to see. With 236 patients, a 1-to-1 randomization, and a solid 6-month follow-up, this was set up to give us some really high-quality answers.
And this is the crucial part of the setup. Both groups got the same standard of care, cessation counseling, and even some WeChat-based support. The only difference, the single variable, was whether they got 8 weekly doses of intranasal esketamine or a saline placebo that looked exactly the same. This kind of design is fantastic because it really lets us isolate the effect of the drug itself. All right, so that's the setup. Now for the big question, the one we all want to know. Did it actually work? Let's dive into the results. And wow, the main finding is pretty striking. Just look at this. At 6 months, the quit rate was 28.8% in the esketamine group. And get this, that's biochemically confirmed. So it's not just patients saying they quit, it's CO verified. Now compare that to the placebo group, just 7.6%. That is a massive difference, nearly 4 times higher. Clinically, that's a home run. So let's put some numbers on that. The odds ratio was 4.88. That means the odds of a patient quitting were almost 5 times greater if they got esketamine. And with a p-value way under 0.001, there's no question this is a statistically rock-solid, very powerful effect. But here's what's really interesting. The good news didn't stop at just quitting smoking. Esketamine also made a real dent in those other problems we talked about. We saw big drops in depression and anxiety scores compared to placebo. And this is fascinating. Their cognitive scores actually got better. On top of all that, their actual level of nicotine dependence went down. So it's hitting the problem from multiple angles. Okay, so the efficacy looks great, but that's only half the picture, right? Especially when we're talking about a drug like esketamine. So what about safety? Let's take a look at the side effects and what the patient experience was actually like. Now, as you'd probably expect, the esketamine group did have more adverse events. The usual suspects were there, some dizziness, feeling sleepy, dissociation. But here's the key thing. The study reports that these were mostly mild, they happened right after the dose, and they were gone within about 2 hours. And most importantly, there were no serious adverse events linked back to the drug. That's a really critical point. So let's pull all of this together. What's the bottom line for you and your practice? I think it boils down to 3 key things. First, it works. Esketamine really does help this high-risk group quit smoking. Second, it does more than just that. It tackles the depression and anxiety that are so often tangled up with the addiction. That's a huge deal. And third, the side effects seem to be pretty manageable and short-lived in a supervised setting. So the big question is, can you start prescribing this for your patients tomorrow? And the answer is, not yet. Not for this indication anyway. Remember, this is one study. A very good one, for sure, but still just one study. It's not in the guidelines, it's not FDA approved for smoking cessation. But what it does do is give us this incredible proof of concept. It builds a really strong case for more research that could genuinely change how we treat these patients in the future. So when you think about it, for these specific patients, the ones with lung cancer, the ones with depression, the ones where we feel like we've hit a wall, this study suggests esketamine could be a whole new tool in the toolbox. It really leaves you wondering, right? If this holds up, where exactly is this going to fit in our treatment plans down the road for this incredibly vulnerable group?